Hi everybody. Today we're going to talk about ADHD, but I'm going to talk about a little bit of a different presentation than we see typically. Very often I'll have a case where a parent brings their child to me and they say, you know what, my child's been diagnosed since they were little with ADHD, and we've tried medications and they've seemed to have every side effect in the book, and we just don't understand what's going on and we need help. And so very often when I run a QEEG on those patients, which again is that map that allows me to look at their different brain waves, instead of seeing the under-aroused brain that is typical in ADHD, I see something called an over-aroused brain or an excited brain. And so an over-aroused brain not only can present in the sense of ADHD in the atypical way, but also things like the child might have anxiety, the child might have tics, the child might have some OCD or compulsive behaviors, sometimes really ruminating over things. If something happens, it's really hard for them to let go. And to explain how that over-aroused brain works, it's almost like when you have a computer and you're on your computer and you have all the tabs open and you have all the circles going on all the tabs and you're trying to complete something, but you just can't because there's so much going on in the background. So that's what an over-aroused brain is doing. And that's why it looks like ADHD, right? Because their brain has all these other programs going on in the background and they can't attenuate or focus at the task at hand. So to help kids that have an over-aroused brain and have the challenges of focus and attention issues, typically what we do is we train their brain to go into the lower gears. And when we train their brain to go into the lower gears, their attention can improve because they don't have all this background noise going on. So neurofeedback can be really helpful for that population of children and adults who have ADHD and haven't responded to the medications, or especially if the medications had made them worse. Because typically stimulants are going to speed up the brain. And for 85% of kids who are diagnosed with ADHD and have an under-aroused brain, that's why you can see results with them. But for those 15% of kids who are taking those medications based on their ADHD symptoms, they have that over-aroused brain, they're not going to do as well. And that's why you see all these side effects. So if this sounds like anybody in your family or friends, please pass along this information to others. Thanks again. See you next time. Hello. Imagine if you could connect to who you were before the Big C diagnosis. Wouldn't it be amazing to tap into the way you used to feel? Your feminism, your vavoom, your life, the way it was. I've been there. I am you. Let's embark on this journey towards healing all parts of you, towards creating the life you deserve and were meant to live. Sign up now to get instant access to the beginning of your transformation. You will get better. You can get your happy back. Hi everybody, today we're talking about teenage anxiety. There are a lot of demands on teenagers nowadays. The academics, the athletics, the social pressures, and some kids are able to manage better than others, just like certain adults can manage better than others. And today I wanted to talk specifically about neurofeedback and how neurofeedback can help with anxiety. You know, I've talked to you before about how the brain is supposed to shift gears, right? Speed up to learn something new, slow down when we want it to go to sleep, and then stay in kind of an idle gear when we're doing things that are routine. When kids get stuck in this anxiety, what happens is that they get stuck in these higher gears. It's called beta waves, and this is why they may not sleep as well as they should, or why they just have that constant angst. And this is really, really important to address. I hear more and more cases of teenagers finding other ways to deal with their anxiety, whether it be drugs, alcohol, cutting. I mean, I've heard so many challenges, and this is a non-invasive way to really help your kids get the help that they need. This is a tool that we can use. Neurofeedback helps to train their brain to have a different pattern. So instead of being revved up, we're rewarding the brain every time it slows down. And what greater gift can you give your kids but the ability to self-regulate themselves, right? If this prolongs, then they find other ways to make themselves feel better, and it's not always the best choices. And we know that the prefrontal cortex, which is the front of the brain, really develops while we're in our teenagehood, And so without that development, they're not able to inhibit their brain the way it should. So in other words, they might make impulsive decisions. And this impulsivity can really create lots of challenges for the whole family dynamic. So my suggestion is, if you have a child that's struggling with anxiety, don't wait for these other things to pop up. Address it now, address it at the source, and get a QEEG so that we can see if that's what's going on with them. Thanks for listening. Talk soon. Bye. Hello. Today we're going to talk about ADHD. ADHD affects children and adults. When people have ADHD, 85% of them have a specific brainwave dysregulation that we see. Basically, a healthy brain is able to switch gears all day long. So it's able to speed up when we want to learn something new, slow down when we want to fall asleep, and stay in a routine or an idle gear when we're doing routine activities. When people suffer from ADHD, what happens is their brain is just staying in this slow gear. And that's why traditional Western medicine's approach to ADHD can be to prescribe stimulant medications. These stimulant medications will take a brain that's performing in a slow level and speed it up. Of course, once the medications wear off, then you're still stuck with the same problem you started with. With neurofeedback, what we do is we reward the brain every time it's producing a higher brainwave pattern. The more we reward the brain, the more we create something called neuroplasticity, which is a big fancy name for new pathways in the brain. The brain then learns to stay in this high gear when we need to focus and concentrate and pay attention. Did you know that neurofeedback is rated level 1 best support by the Journal of the American Academy of Pediatrics? Yes, that's true. So it's a very well-respected therapy and highly researched. The best thing about neurofeedback is it's non-invasive and the FDA reports no side effects. So considering BrainCore, which is our form of neurofeedback, can really help children and adults alike in order to change their brain and change their lives. Until next time.
I guess probably when I was about in my mid 40s, my youngest daughter was showing signs of ADD, so we went and we investigated her, and I was not very receptive to any of the normal clinical things that people do. So I did a lot of research, and at that time when we were doing all that research, it became very apparent that it was something that I have struggled with my whole life. Back then it was just called the ants in the pants and not being able to focus. So when we started her on a medical protocol, I guess, at the same time or thereabouts, I went on one myself. And I guess I was on it for about 4 or 5 years, maybe a little bit longer, and then got introduced to New Life and learned about BrainCore and decided to try it, and just have had fantastic results. Totally med-free. My youngest daughter we've reduced her medicine. My oldest daughter has anxiety issues, and she's seen great improvements with it also.
Chris came to me and we did a diagnostic procedure on her called a QEEG, and what we found is she also had an elevated theta-beta ratio, which is seen in 85% of people with ADHD. It's really the classic hallmark sign to let us know as BrainCore doctors that we can effectively help a patient. After 20 visits with Chris, she saw a dramatic improvement. In fact, she's completely off medication and has maintained that for over 4 months we're at right now. So really dramatic result within way under the 30 visits.
I have recommended BrainCore to pretty basically anybody who I meet because I think the benefits are far-reaching. I think, I have 3 different examples in my family. My youngest daughter is ADD. We've been able to reduce her medicine. I have ADD. I've been able to come off medicine. My oldest daughter has anxiety issues, and she's just been through some pretty anxiety-induced circumstances with college, and she made it through fine. So I have very concrete proof that it does work.
People take medication every day for anxiety, depression, even insomnia. But a new technique could make it all go away by simply using your brain power. CBS 2's Andrea Grimes shows us how you can train your brain.
When it's light or bright, that's when she's producing the desired brain wavelength.
That's right. This patient is manipulating the brightness of the screen with the power of her mind. It's a treatment called brain core therapy.
Your brain is constantly being molded with a feedback mechanism, a positive reinforcement to show you that this is the proper brainwave pattern.
Positive reinforcement for this therapy entails making a video screen appear lighter, or here, keeping a roller coaster moving smoothly. It works, according to Dr. Carrie Chapino, by patients concentrating on these activities. She says research shows that over time, the brain will establish new connections that can help break the cycle of depression, insomnia, and certain pain.
I'm not about to get a facelift, but I can give my brain a lift.
Marilyn Sokol says she was having issues with mood, focus, and trouble sleeping, so she tried brain core therapy.
I'm really sleeping and not getting up for any reason.
She saw other benefits too.
I was always a slow reader. I do believe that there has been an improvement.